GST. Welcome back. And if you're just tuning in, you're listening to HealthTech Talk, broadcasting from iHeartRadio Studios, 640 WGST, and streaming worldwide on the iHeartRadio network. We just finished a great first segment, but our second segment is going to be just as amazing. And with me is George England. He is the CEO of Doctors Mobile Healthcare International. It's a long name, but it's an amazing organization. The show is called HealthTech Talk. So we're really about where does healthcare and technology, converge, and his company does exactly that. George is not only the CEO of DMHI, he is a 26-year healthcare veteran. He has not only helped other companies, he has been with lots of different startups, and Doctors Mobile Healthcare International is a publicly traded company dedicated to help surgeons, medical institutions, and medical vendors improve clinical and financial outcomes. What else can we ask for? Better outcomes and better financial outcomes. George, welcome to the show. How are you today?
Thanks, Ben. It's great to be here. I'm doing fantastic.
All right. So really quickly, give our audience just an overview. What is the mission statement of Doctors Mobile Healthcare International?
Well, Doctors Mobile Healthcare International is a company, as you originally said in your opening. Our mission statement is to help physicians drive revenues, save time and money, of course, improve clinical outcomes of all their patients, and then also add something that's extremely important and missing a lot in healthcare now, and that's accountability. How do we keep everybody accountable among all the stakeholders that are delivering care to patients? And that's critically important, especially to our niche, which is surgeons and around the surgical space.
So when you guys were starting the company, what made you decide to go down this route? I mean, there's a lot of areas where technology and healthcare converge in the healthcare area. What made you think about, surgeons?
Well, I got into the surgical space a long time ago. I used to watch guys go in the hospital with scrubs on. They were sales reps, and they were going into the OR, and I thought to myself, man, how do you get that job? How do those guys get to go in the OR and see all these procedures? And, that was about 25 years ago. And that was my first exposure really to surgery and the surgical experience and all the things that were being sold from the vendors into that experience, like total joints, sports medicine, screws, and then when spine surgery started to really boom, plates and screws and rods. And so that was really my background initially, working with surgeons. And I saw all these surgeons using all these implants and working with all these different vendors, and the dollars just became astronomical in the industry. Orthopedics, billion-dollar industry. There's billions of dollars of implants being used every year. The same with spine. Also cardiothoracic with pacemakers. Some of the biggest companies in the world in the healthcare space are around selling pacemakers and cardiothoracic implant devices. And so as those dollars started to become huge and the hospitals were spending more and more and more money on those devices, the technology became more and more complicated. It became apparent that there needed to be something to actually help control the costs and to control what we call in the industry the chaos that goes around these implants being shipped in from vendors and sales reps running around their cars and dropping them off at the hospital. So we started a company, and I was involved with a company a number of years ago around clinical outcomes and collecting clinical data for physicians. Typically, clinical outcome data is collected for studies. Anytime a product or a new procedure or a drug is released or approved by the FDA, they first have to do a study that collects data, obviously, clinical outcome data. They submit it to the FDA, and the FDA either approves or disapproves of that. So I was exposed to the IT side of medicine about 10 years ago in trying to create a portal that allowed surgeons to collect clinical outcomes. And it dawned on me, we have all this fantastic technology now, literally the technology for cell phones. What you can do on a cell phone now is crazy. So how do we utilize that technology and help all of the stakeholders, the sales reps, the hospital staff, the surgeons that are doing all these procedures, to create better care by saving money, making things more efficient, and ultimately creating better outcomes for their patients?
Wow. Wow, that is amazing. And how have the surgeons embraced it?
The surgeons love our technology. Doctors Mobile Healthcare International has a mobile platform called Virtual Physicians Network. The Virtual Physicians Network is Doctors Mobile Healthcare International offering into the mobile platform space for surgeons. And so surgeons can use Virtual Physicians Network to communicate all of the needs that they have for surgery to all of their vendors. Most people don't realize that if you go in to see a surgeon and you have to have a total knee or you have to have neck surgery of some kind, that surgeon will sit there and he'll check off and put, usually on a piece of paper, check off exactly what's going to be used during that surgery, and then give it to someone in his office to call the hospital, and then call all the vendors that are going to bring in all of the equipment to be used in that surgery, because none of it resides in the hospital anymore. It's too expensive for the hospital to carry it, even on consignment. So we created this mobile platform technology called Virtual Physicians Network so they could communicate all of that through a mobile platform. Everybody's on the same page. It creates instant accountability. All the vendors can communicate back to the surgeon and to the hospital that they have everything they're looking for and it's going to be delivered on time, and everybody's happy.
So let me get this straight. So it's a win-win for the physician. It's a win for the vendor, the device company or the product company. So there's no downside for this. And there's only a chance to save money. So it goes back to what you were saying. It's about driving revenue, saving time, creating a better clinical outcome. So your prediction's coming true. So here's the question. What am I looking at? When I'm using the Virtual Physician Network and I am one of the physicians, is it an app? Is it a device? Am I looking at an iPad? How do I use the technology?
Right. So now, since technology has advanced so fast, just a couple of years ago, technology started really through web-based apps. Like people said they had mobile apps, but it was really had to go through a browser. Now we have actual apps that are on phones. We have apps that are on iPads, and we also have those applications that you could find through any computer on a browser. We have all of that. So we've taken our program, Virtual Physicians Network, and we've put it on a web-based application. We've put it on all iOS devices, meaning your iPhone, your iPad. We've also put it on all Android devices, phone and iPad. So if you're a surgeon or a staff member in that surgeon's office, you can go on any of those devices, enter any of that information or look up any of that information, and it's available on any of those devices. So if a surgeon wants to find a sales rep or wants to find maybe a surgical technique for a product, he can look on his phone, or she could look on her phone. If a staff member in the surgeon's office wants to actually schedule a case and order the equipment from 4 or 5 vendors, they could do that on the computer, an iPad or phone, and then the surgeon can actually see it happening in real time on their phone. Meanwhile, all the vendors can also communicate and see it on their device as well. So believe it or not, this technology, it sounds like most business, well, of course, most businesses do this now, but it hasn't been available in healthcare.
It's just you're putting it all in one place for me. So you're making my life easier, gives me one place to log in and check my – can I also – does it have my appointments or my schedule and my surgeries? Does it do that as well?
Yes. So one of the things that's very important to us is the Patient Privacy Act, which is called HIPAA in the industry. So patient privacy is very, very important. So we created a private network. Virtual Physicians Network is a private network that you have to log into, whether you're the surgeon or you're the vendor or you're the hospital staff. And that information sits within your account in your application. So a surgeon anywhere at any time of the day or night, can open up that application, say on their phone, and see their surgical case schedule. Not only that, but they can also see that the vendors that are involved have confirmed their involvement. In other words, and we call it easy buttons. You hit an easy button, you see your cases, and it's either green or red, meaning those vendors have confirmed it or they haven't confirmed it. Easy, simple, and it makes life easier for everyone. Instead of communicating through emails, which is not necessarily HIPAA compliant unless it's within a private network, or texting or Google Calendar, it's very difficult to keep that privacy in place with those other opportunities.
George, I need to interrupt you for a second. I want to remind our audience we're talking to George England. He's the CEO of Doctors Mobile Healthcare International. I need to take a commercial break. I want a special shout-out to 1-800 Public Relations for all their PR and media support, and to everyone at Stream BPG for all their production support, especially John, Jeremy, and Scott. And we'll be back after these messages from our sponsors.
Hey, this is Mara Davis, and right here on 640 WGST, we talk food, 11 to 12. Don't miss us every Saturday, 11 to 12 on 640 WGST.
Join host Ben Chodor every Saturday at 3 p.m. for HealthTech Talk. Technology is changing how healthcare is being delivered. Their special guests will talk about how healthcare, science, and technology are enabling patients the ability to take control of their own health. Join the conversation Saturdays at 3 p.m.
Folks, you know your car is a huge investment. It's got to be reliable enough to handle that Atlanta traffic. Well, that's why, for peace of mind, take your car to Cooper Lake Automotive. They have over 40 years of experience maintaining cars, trucks, and SUVs. And all of Cooper Lake's employees are certified mechanics and college educated. You can trust these guys. So stop by Cooper Lake Automotive today to get your car ready for summer travel. Online at CooperLakeAutomotive.com and tell them Dave Ramsey sent you.
Hi, folks. Alan Thicke here, and you've probably heard, maybe from me, that if you owe the IRS money, they can do some scary things. Garnish your wages, levy your bank account, even seize your home or business. You add on the penalties and interest, and getting out of debt can seem impossible. Back taxes are for real. It's not a game. But the game changes when you have a team of tax experts on your side. The professionals at Optima Tax Relief can immediately protect you from aggressive collections. And for a limited time, the IRS is offering a tax debt forgiveness program. It's called the Fresh Start Initiative. With the help of Optima, you may qualify for a settlement that saves you thousands. Nobody knows the game better than the Optima team. Don't wait till it's game over. Let their experts coach you through this. It's a win-win. Call for your free consultation.
Call 800-798-2477. That's 800-798-2477. 800-798-2477. Some restrictions apply. For complete details, please visit OptimaTaxRelief.com.
Ever have one of those days when the clutch in your brain goes out, your mouth won't work, and you cannot find a good attitude to save your life? Hi, this is Jeff Foxworthy. When I have a bad day, I try to remember those kids that I have visited who are fighting cancer. Their little bodies are weak from battling this dreaded disease and from surgeries and cancer treatments, but they're not sad or down. Incredibly, they have this great attitude that they're going to beat the tar out of this monster, childhood cancer. They believe they'll survive. In their courageous hearts, they believe we, the grown-ups, will do something about this monster. They believe and trust in us. If these kids have the heart to keep fighting and living, then the rest of us must have the heart to help them. Your donation to Cure Childhood Cancer will help fund the life-saving research for kids who are battling and believing. It'll make your day. Donate at CureChildhoodCancer.org.
Are you paying too much for term life insurance? There's a tremendous price war among the major term life companies, and rates have dropped dramatically in the past few years. For example, for a man age 45, non-tobacco user, it's $1 million of coverage and $75 per month level rate for the next 10 years. Or a man age 50, non-tobacco user, can obtain $500,000 of coverage for a monthly premium of only $110 per month, guaranteed not to change for the next 20 years. That's right, level rate guaranteed not to change for the next 20 years. If you're a smoker, we have great rates available for you as well. At Term Busters, we specialize in policies of $500,000 and above. If you're looking for new or replacement term life insurance, call today for a quote at 1-800-862-8376. That's 1-800-862-8376. You're probably paying more than you should. Call Term Busters at 1-800-862-8376 or visit our website at termbusters.net. Remember, 1-800-862-8376. Rates and availability may vary by state. Sample rate quotes based on preferred non-tobacco underwriting. Exam required to qualify.
Talk Radio 640 WGST.
Welcome back, and if you're just tuning in, you're listening to HealthTech Talk, broadcasting from iHeart Radio Studios, 640 WGST, and streaming worldwide on the iHeart Radio Network. I'm Ben Chodor, your host, and with me is George England, CEO of Doctors Mobile Healthcare International, a really innovative technology that basically combines the surgeon with the product, and it saves money, and it's great for clinical outcomes, and it's just an amazing, amazing product, and we're learning more about it. We were learning about some of the feature set, but George, I want to jump in. As a physician, can I also get education from the technology, or is it really more about ordering product, scheduling appointment?
Right. So the Virtual Physicians Network application, what we call Book a Case, that is just one of the simple tools that we have that makes life much easier for everyone involved. But we also wanted to give the resources that make it compelling for a surgeon to have on their phone or their iPad or their app. And what is that? That's access to information. Surgeons, particularly, all healthcare professionals, are bombarded by new products, by new technology, by new FDA approvals. And it is very, very difficult to keep their hands on the latest information. So what we wanted to do was we wanted to find one spot, an easy button, if you will, where we can amalgamate all of that information, give the vendors the ability to take all of their educational resources, their surgical techniques, their marketing pieces, and put them all in one spot so a surgeon or healthcare professional in the hospital could touch that button and find education. They could find the latest meeting. And more importantly, the Virtual Physicians Network is very intuitive. So when a surgeon is thinking about something specific, like, let's say, neck surgery, that surgeon can find something specific for neck surgery right within Virtual Physicians Network. Maybe it's the latest meeting on a new product that's coming out. Maybe that surgeon wants to register for that meeting. Or maybe they just want to find when the next seminar or journal article has come out on that product. They can find it all within the app, quickly and simply. Instead of having to go through a number of different websites or do Google searches, we have it all there right for them.
George, when did you launch the product?
Well, we've been working on this Virtual Physicians Network for about 4 years. So Doctors Mobile Healthcare launched the Virtual Physicians Network live in November of this previous year. So our coming out party, if you will, was at the North American Spine Society meeting in San Francisco this past November in 2014. And that's where we really went live with bringing on new surgeons and accounts onto the application.
Wow, that's great. So what are some of the key milestones you're looking to achieve in 2015?
Well, first of all, we're very excited that Virtual Physicians Network is now available in the iOS, in the App Store for iPhone and iPad, and also Google Play, and available on the net. So anybody can utilize it right now. The milestones that we're looking for is now we're bringing on major vendors in the industry, specifically right now focused on spine surgery. We're bringing on vendors that they can give this application to their surgeons and hospitals. So we believe in the first half of this year, we're going to be building our network of surgeons, of spine surgeons. And then the next piece that we're going to release within the application is what we call the hospital experience, where all the communication and education and pieces that are available to the vendors and surgeons now tie in all the hospital personnel. So we hope to have that done relatively soon, hopefully by the end of this quarter, as a matter of fact, or certainly by the summertime. And then later on in the year, this platform is built around the surgical experience. Yep. So right now we're focused in spine. We're also going to have an orthopedic experience that's going to handle trauma and total joints and sports medicine. And then the next module will be cardiothoracic, and then on down the line into different specialties.
That's amazing. So I have two questions for you. First, how are you marketing it? How are you getting the word out there, besides doing radio shows like mine?
Sure. Well, in the industry, the best way to market a program like this is go to the trade show. Like the North American Spine Society, for instance, had well over 2,000 spine surgeons that attended the show. Plus, they had hundreds of vendors. So we have all of our customers really in one place for 3 days. So as we launch this and expose this to institutions and hospitals around the country, we also expose this to vendors that have large sales forces that are bringing it to all their customers as well.
Wow, that's great. Are you going to build a large national sales force, or are you going to partner with other sales forces?
We're going to partner with the other large major vendors in the industry and support their sales force. We are not going to have a large sales force ourselves because we want to empower the vendors to be able to use these tools and help them in their business.
So can I guess, being from my background, I'm a big streaming media guy. So
Sure.
Will live surgery video and live video education be delivered to physicians coming soon, or is it already happening?
Yes. Yes and yes.
Oh,
it
great.
is available right now, and we are going to expand that part of Virtual Physicians Network. We are going to be able to offer live surgical experiences where surgeons can participate. Right now, there's a lot of training that surgeons have to go to. It's more and more difficult for them to leave their office and to leave their practice. Again,
Hey, George, I just wanted to interrupt. So just so our audience knows, every doctor has to get a certain amount of what they call CME, continuing medical education credits, and that is what George is talking about. For those of you who don't know about the physician, education. So go on, George. I'm sorry.
Correct. So those CMEs, every physician, every healthcare professional needs those throughout the year. So we are going to partner with companies that provide those and allow them to participate through our mobile app to be able to pick up those CMEs. So they can do it two ways. They can either sign up for courses, they can find courses that they otherwise couldn't find right through the app and sign up, where they may have to participate somewhere in another part of the country, or they could actually eventually participate in those events right through the app. So they could pick up the continuing medical education right through the app experience, through those streaming media events.
Cool. So, George, I got to ask the question. I ask everyone who's on the show this question. How does the company make money? Do you charge the physician to practice, or is it from sponsorship from the device companies?
We absolutely give this to healthcare professionals for free. This is something that is extremely important in the industry to provide value. The vendors, the device companies and the pharmaceutical companies are the ones that pay for this through advertising, marketing, and also through content hosting and sharing in revenue for media, for meetings or educational events that the physicians may participate in.
Great. So, George, just remind our audience, how can they get in touch with your organization and where can they find you?
Well, you could certainly come to our website and find all about Doctors Global Healthcare International at DMHINTL.com. That is the best way to get a hold of us. We also have, you could also come to our other website, Virtual Physicians Network, which is another great place to come. Or you can contact me personally. You could always email me at george@DMHINTL.com. I'd be more than happy to talk with anyone.
I love a CEO who's accessible. I have to wrap up the show. George, you were an amazing guest. I want to thank all my guests today, and I especially want to give a shout-out to 100 Public Relations for all their media and PR support, and to Stream VPG for allowing us to use the studio, and especially John, Jeremy, and Scott for all their support putting the show together. You've been listening to Health Tech Talk. We'll see you